Okay.
Great. We'd like to welcome Shoshana Inwood with us today. She is a rural sociologist with Ohio State and an associate professor, and she holds a degree in rural sociology and environmental science and biology. Her career is focused on the intersection of agriculture, environment, and society in the context of community and economic development. And we're pleased to have her with us today to talk about collaboration between Ohio's food and agriculture sector and the state emergency management process. Welcome, Shoshana.
Thanks, Gwen. Thanks so much for inviting me. And it's really nice to be with all of you today. And since we're a nice group, like if there's any questions or thoughts you have or experiences, like just I'm really happy to have a conversation and for this not to be a death by PowerPoint at you kind of presentation. So yeah, so I just wanted to go over a little bit about some of the work that I've been doing for the last couple of years around preparing Ohio's food systems for disasters and disruptions, and the partnership that we had with Ohio Emergency Management around this project. And I just also want to acknowledge my team that's been working with this, because as we know, we never work really individually. It's always a team effort. So Zoe Plakis, who's no longer here, but an AEDE, and it's been a great partnership also with the John Glenn College of Public Affairs at OSU with Jill Clark and Aiden Irish, and then Nicole Wright, who is actually now with the Sea Grant program here at OSU. So what I really wanted to do was three things today, just kind of take you back to 2020. You may not want to go, but we're going to take a trip back in time to really talk about food systems and emergencies pre-COVID, and then talk about how and the types of shocks to the food system that COVID induced, and how that really affected also our emergency management system. And then share with you the research that we've been doing around preparing for the next disaster and disruption. And we've been doing some really great mapping and creating some databases, all of which are publicly available right now, and talk a little bit more. I'm really, really curious to hear your thoughts on how we can better weave together emergency management, extension, and our food systems at the local level, because it's really that last mile of implementation where things are so important. Whoops. And so like also as we go through this, just keep in mind and think about this, because I'm really interested to hear your thoughts on do the findings that we came to make sense to you? Is there anything that surprised you? What parts of the database and maps do you find interesting, and how could you even envision using these tools? Because that's also really important feedback for us as we continue to think about types of outreach materials. For those of you who don't know, I actually have a 60% extension appointment. I'm 60% extension, 30% research, 10% teaching, and I'm based up in Worcester at OARDC. So I really want to make sure that this research doesn't just sit on the library shelf, but actually gets used and is useful. Okay. So, a lot of the work that I do, as Gwen shared, is really thinking about who's going to be the next generation of farmers, and thinking about community and economic development through food of agriculture, and really thinking about some of the larger food system trends that we see, where there's a shrinking and aging farm population. We see the bifurcation of farm size with increasing concentration and consolidation across the farms sector. But at the same time, we see increasing interest and resilience among small and medium farms, local food systems, and wealth-based approaches to economic development through food and agriculture. But all of these things are also really vulnerable to different shocks that can hit the system. And it could be domestic trade wars, it could be a cyber attack, it could be a climate shock through extreme weather events that can all have big potential to disrupt the system. And to be honest, when I was really interested in this, and for a long time, it's my interest in disasters and disruptions in the food systems, and nobody would really talk to me about it until the pandemic happened. And then it was like, oh yeah, I guess we really do need to be paying attention to this. So it's really also opened up a new conversation for how all of these things fit together in terms of building a more resilient food and agricultural system. Okay. So taking you back in time to really think about before COVID, and even today, really thinking about how did emergency management conceptualize food system preparedness in a kind of emergency. When you look at some of the websites like FEMA or our Ohio EMA, what you really see is a focus on preparation for 2 to 3 days for an extreme event, and then maybe for a couple weeks, but always the assumption that events were going to be highly localized, like a tornado, a hurricane that comes through, with the assumption that food could be brought in from another county, from another state, but that the food and water supply that you needed to stock up didn't have to be very long. And also a lot of the focus has also been on food safety, right? If your refrigerator goes out, a lot of concern about foodborne illnesses, right? So safe handling, safe storage, all these things really important. And that was primarily the focus for food in an emergency and disaster. There is one notable example of before COVID, the city of Baltimore actually worked with Johns Hopkins University and actually did a systematic study thinking about how could and is our city actually prepared for any kind of disaster and how it might affect our food system. And one of the really interesting things that they found is that actually a lot of the state agencies and city agencies were not talking to each other. They did not necessarily see this in their role. And the Johns Hopkins folks came to the realization that before any planning could be done, it was actually necessary to do a lot more weaving and building relationships across the different agencies at the city level, and for them to actually recognize their role in the food system. And we'll see that this actually is very relevant to what we found in Ohio and across other cities. Okay, so again, going back to 2020, going to take you through that that tour of what we all lived through and how COVID shocked our food and emergency system. So you can remember, right, maybe in some of your communities that the grocery shelves went bare, not just in terms of toilet paper, but in terms of especially meat. Right. There are a lot of issues with livestock processing that happened that all of you are intimately aware of. And we saw that manifesting in empty shelves at the grocery store, right? All of these different shortages of basic foods. It was also really hard to coordinate food assistance during this period. For the food banks, a lot of them relied on retirees, on older individuals who were very vulnerable to COVID. And before the vaccine, before we really knew how to protect ourselves with masks, right, there was a whole loss of volunteer base for food assistance. And that created a lot of disorganization. And if you remember here in Ohio, the emergency guard, the National Guard was actually brought in to assist with food assistance. So right, we had this vulnerability of the food assistance volunteers, and we saw some really interesting examples too of different individuals and organizations filling those gaps, right? This is a really great story of how the sheriff's office and also highway patrol assisted in meal delivery in some communities. What we also saw happening though is a shift in the types of foods that were delivered. So it used to be that there was a lot of scratch cooking, right? Really thinking about diet and nutrition and where that was being provisioned from. But with COVID, there's been a shift to more prepared, canned, highly processed foods that also are not necessarily even coming from Ohio, but being brought in from Texas and repackaged here. So there's also been a shift in who's doing the cooking, what the quality of the food is as well. And again, you know, where emergency management really thought about these very local disruptions to supply chains, right? What we saw during COVID was a global disruption of supply chains. And it wasn't just in terms of our actual food, right? Which is oftentimes like as in these you know, images are showing pears grown in Argentina, packed in Thailand, sold here in Worcester, Ohio, right? But it was also, as you well know, the inputs, right? Whether they were medications or fertilizers or, right, all of the things across the supply chain that you need to actually grow and deliver food, were those routes were being disrupted. And at the same time, we saw a lot of conflicting and confusing information in the news, like why is milk being dumped even as people go hungry, right? And we really started to see the complexity of the supply chain and how different laws can affect the ability to distribute food. Labeling issues, right? There are a lot of shifts. This is a rapidly shifting policy environment. These are just headlines I grabbed daily, where every day the policies were changing and the way that aid was being distributed or not, right? Thousands of children in Alabama could lose school meals as waivers expires, right? How is SNAP being expanded? Then there was a shift to the food box program. So it was a really confusing time in terms of also managing the food supply and especially the emergency food supply for people who were both chronic, but then also all of a sudden who were newly food insecure. At the same time, when we're thinking about community stability and also community well-being, there were also these issues with housing, right? Also, emergency management had to coordinate housing as people were losing access to housing because they couldn't pay rent. And then also, if you remember, individuals who had to be quarantined were also being housed in hotels. And that leads to a lot of labor housing issues. And I know that all of you work in the energy area. And as you know, housing is a huge issue. And this just, created more cumbersome and challenging situations that had to be addressed. And again, when we're talking about community stability, when people were losing their jobs and were no longer being paid and then being threatened with eviction, that creates, right, a lot of instability, both at the individual level, the family level, and the community level. The other part that we saw, if you remember during COVID, right, was the importance of essential workers and bringing them to work, but also the vulnerability that those workers faced, not necessarily having access to enough PPE or the correct type of PPE. And that was a really big stress. Also, then there was these shifts also to different types of delivery services. But again, there was a labor component to that for individuals experiencing COVID differently. At the same time, right, the vulnerability of food producers, there's a lot of conversations about the boom in local foods, right? But at the same time, right, we have an aging farm population, and that was also very vulnerable to COVID. We also had farm workers who were very vulnerable to COVID, especially because of the housing and transportation systems, right? When you're in the field, maybe you're not close together, but the way that you are living and moving can increase the risk of COVID. And so that became another big issue is to our food supply, right, was the ability for the workers to keep working. One of the other things, my brother-in-law is actually a truck driver, and we don't often think about how important transportation is for our food system, right? Actually, the Ohio Department of Transportation doesn't, I'll talk about it in a little bit, like they didn't even see themselves as part of the equation for our food system. But if you remember, here in Ohio, the highway restrooms were being shut down. Truckers were losing access to a lot of the restrooms at the big box stores like Walmart, where they were able to use facilities previously. During COVID, they shut them down, and all of a sudden they could not relieve themselves. They couldn't get access to food and services. And that introduces a lot more risk into the system when they're traveling with perishable foods or traveling with livestock, right? So we think about zoonotic diseases, right? When you're stressed, you're not necessarily going to comply with all the safety regulations that you may need to in order to ensure a safe food supply. So that was another part that we were seeing a vulnerability into our food system. Another component is we don't often always appreciate the role that food plays in family stability. During COVID, we saw a lot of rates of domestic violence increasing, right? Especially as people were forced to be together. And we don't often appreciate that food can actually be a primary trigger for a domestic violence incident. You don't like the steak was too salty, or you didn't get the right kind of peanut butter, right? And then that escalates into a larger argument that can lead to physical violence. And that, of course, has effect both on the family, the ability to get to work, to get to school, which then compounds impacts on the community. And, when there was that food box program and people were forced to not necessarily have choice in the type of food that they were getting, I think that also probably added to some of these issues as well. And again, we did see this really great interest and surge in local foods, right? And so, the numbers started to skyrocket, lots of demand. At the same time, though, when you talk to farmers, there was also concerns about, well, like, wow, yeah, business is great, but at the farmers market, should I be working? Should my parent be working? Are we vulnerable? Do we have PPE? Also, my children are at home because school is closed down. And we actually heard from a lot of farmers through some of our survey work nationally that farming became harder because taking care the kids were home and they had to take care of the kids. So I think, it's important to always appreciate these headlines with a little bit of nuance. This was the image, right? So for those of you who don't know, a lot of my research is actually looking at how access to affordable, quality childcare and health insurance affects economic development and quality of life. And so COVID was a really stressful time period, especially for farm families who had younger children who were school age. And they talked a lot about that complexity. And of course, like, right, there's intersectionality in the way that you experience COVID, and the impacts really depended upon where you were geographically, right? Rural, urban, suburban, every community experienced this a little bit differently. Also based on your age, your race, your gender, your ethnicity, right? All of these things impacted and influenced how you experience your lived realities. So also what happened during COVID was I think I started asking too many questions, and on a phone call, Dean Kress said, well, okay, Shoshana, you and Zoe Plakis are now co-chairing the college's COVID-19 and food supply task force. I was like, oh, well, what are we gonna do? Okay. So our task is really to try to coordinate with folks in Extension and within the university about what was happening, and also network with our colleagues nationally to understand what was happening in different states. During this time period, Ohio Emergency Management actually contacted us and said, you know, there's this food box program, a lot of it doesn't make sense to us, and we want to understand the food system and how the food supply chain works. So we actually started a partnership with ESF 6 and ESF 11. This was all like a new world to me, but Ohio EMA has 15 emergency support functions, and 2 of them primarily deal with food. That's ESF 6 and ESF 11. And just, as an overview, these are the different Ohio EMA regions. And so you can, find yourself on that map. I'm in region 5. One of the interesting things too, right, when we're seeing all these things, when OEMA was like, we need to understand what's happening and how to respond, is when you go into the literature, what's actually interesting is back in 2015, there were some articles published actually looking at food system resilience to disasters and disruptions. There was a conference that was done by some social scientists, and this group of researchers actually did this study specifically focusing on pandemics and looking at how resilient is the US's food system pandemic. And they found that it's actually not resilient because of worker absenteeism. So that labor, right, that piece about the human part of the system is highly vulnerable, right? And I think what we also saw during COVID is that our food system at large is highly efficient. It keeps food at a low cost, right, relatively low cost, right? But that really large system is vulnerable to shocks. Right? It's highly efficient, but it's not very flexible, right? And that introduced a lot of the different shocks. So where do we go from here? So with Ohio EMA, we said, we can't fix the issues that we're seeing with COVID, but what we can do is try to learn from them so that we can better prepare the state for the next disaster and disruption, right? And to do that, right, we first had to think about, what does resiliency even mean in a food system, right? And so there's the idea of ecological resilience, right, where there's the ability of a system to continue functioning and recover from a disturbance, right? And that's one form of resilience, but then there's also social resilience, right? And what does that resilience look like at the individual level and also at the community level? Right. And where we're really focused in for this study was really at the community level, right? How is a system absorbing disturbances and being able to retain its basic functions? And what are those adaptive behaviors, right, that allow it to address the issues, but also to change in the future, right? And also really thinking about power and who has the power to make decisions and to influence things in the system. So we really thought about, how do we weave food system into emergency management? And what we wanted to do was take a baseline inventory of how state agencies, the private sector, and civil society intersect with the food system to respond to disasters. We wanted to map the food system actors, policies, and programs, and then position OEMA to really respond to these future disasters and disruptions. And we had some funding from OSU to do this. And you can see on the right, here's our very simple, very naive sketch that we started out with, okay, if you're an Ohio family or a business, here's the different agencies and ways that you might be interacting to get your food needs met within a disaster and disruption. And you'll see this is really very, very overly simplistic from what we realize is actually going on. Okay, so this was a 4-phase project, right? We did the database work that I'm going to show you. We assembled a database of different policies and program, which lives online on our website that you're welcome to use at any time. We actually did interviews with state agencies, and then we actually mapped these different pieces and parts together. And then the final phase, which is really where we're still working, is to try to facilitate interagency conversations and create some case studies. And this is where I'm also really curious to hear your thoughts and ideas of how you can imagine using the tools that we developed during these 3 phases, the first 3 phases, to inform the 4th. Okay, so this is what our policy and program database looks like. It's really not one I'm going to tell you that we update, right? This is kind of like static in time, different policies and programs that connect to food and agriculture in the state, because OEMA said, there's not one place where all of this lives, right? And so our hope is actually that OEMA will take this over, this database, to be able to monitor it and use it and update it as they see fit and needed. So with the Glenn School, it was really great is we started to try to do these policy field maps to actually understand how does food system policy actually trickle down from the national level to the state level to the local level, right? And this is an example of one that we did for food assistance, SNAP and SNAP-Ed during the pandemic, right? Where we're looking at what's the political influence, who are the private sector actors, the public sector, who's got the administrative authority for these things, where's the funding going, right? What's the education and advertising, and who's the target audience? So this was like, one piece of the map. And then what you can see is when we looked at all the different food security and ag policies, right, you start to see this becomes a lot more complicated, right? A lot of different things are happening at the same time. So when you look at this map, what do you see? Anybody who wants to answer?
It looks confusing.
Yeah, right? It's a mess.
I've seen that map.
Looks like a schematic.
I've seen that map before, basically a few years ago, and I'll explain that later, but I described it then and now I see bedlam.
Yeah. Those are all great descriptions. And that's why we call it the fog of response, right? And what this is these are the different food systems, policies, and programs. And what you see layered on is ESF 11 and ESF 6. So those remember the emergency management agencies. And what was really interesting is when those folks from ESF 6 and 11 looked at them, they're like, wow, we don't overlap as much as we thought we did. And it also was like, this is why responding to COVID was so complicated, right? And this is also what we got out of our interviews, is that the state agencies, right, all of these things are very siloed. It's very confusing, and you don't know what anybody else is doing. And so one of our partners said, wow, this is like the fog of war, when soldiers are in the fog of war and they don't even know if they're shooting on their own troops or not. This is what is happening. So we call it the fog of response, right? Which I think helps to explain some of the issues that we saw during COVID. And so just kind of briefly, some of the big takeaways that we took is that food programs are administered across different agencies with limited connection and communication. And I think that's just as frustrating for the people within those agencies as it is for the individuals affected by those outcomes, right? I think that they're very frustrated themselves because they care very passionately about the work that they do. Agencies can impact the food system even when their responsibility is not related to the food, like the Department of Transportation. And that's one of the prime examples. They were actually the hardest for us to even interview in terms of their willingness, because they just don't see that in their mission as being connected to the food system. Right now, we have no current structure for agencies to plan and coordinate food policies for either the short term or the long term. In the state, we used to have a food policy council at the state level. We don't have that anymore. So that was a formal mechanism through an executive order that had the agencies coming together and meeting and building relationships. And that was a couple of administrations ago, and that does not exist any longer. And that was really a very striking contrast to other states. So we have colleagues that we work closely with in Colorado and Vermont, where there are agencies like the Department of Agriculture in particular that's much more programmatic and not just regulatory. Our Department of Ag is very regulatory in its focus. And so the responses were very different in those states compared to what we were seeing here in Ohio. And during COVID, essentially what happened was there was almost 50 different state experiments happening because a lot of it also depended upon how your state agency of agriculture was structured. So what we really see is that COVID is this opportunity to rethink relationships and how do we coordinate to better handle those resilient, those shocks to the system that we know that can happen. And so within disaster, there's also those moments for how do we leapfrog and create a more resilient system that is really also benefits our local farmers and our local communities. So we have on our website the final report. So it's a 20-page, really accessible report. We have the database. We have different field policy maps that we developed. Some are much simpler, some are much more complex, but there's a variety of tools out there that hopefully can then be used, for further studies, for further implementation as well. When we're thinking, some of the things that we're thinking about for how do we weave food into emergency management, right? We've been trying to actually convene the state agencies to ask, are the maps accurate? What's missing? How can we use those experiences to develop case studies and training to create training scenarios? How do we make that database more useful? And one of the other things is that we saw there's really a need for kind of a food systems 101 professional development for state agencies, especially as new folks come on board. I think sometimes when those of us who work in the food and ag space, like we forget how complicated this system is and how many people don't really understand how it truly works. And then really, how are we working with our civil society partners and nonprofits? And especially at the local level, I think that this is a really tricky question because every county has an emergency management coordinator, right? But a lot of times, especially in rural communities, those positions may be half-time, right? They may not be paid well. How well are they being thinking about and integrated into the food system? So I think that there's also some opportunities also really for extension to think about how are we as conveners and facilitators, how can we be building more resilient systems within our communities? Because so often, even if we have a really great intentioned policy and there's funding, it's that last mile of implementation where either it happens or it doesn't, right? And so how do we prepare ourselves and those tight networks to be better prepared for future resilience issues? Yeah, so this is basically like, how do we think about this from both a bottom up and a top down? So I've been talking a lot. This is kind of a big overview, but I'm really curious to hear your thoughts about this work and how you see this operationalizing or not in the work that you do.
Shoshana, I think you make a great point about rural plans, that this isn't something that's thought about. And the economic development work that I do, the EDA administration does a regional comprehensive economic development strategy called the CEDS in most of the regions. And our meeting yesterday, there's really nothing in our document about agriculture at all across our 8-county region. And I brought up the point of, just how many farms are in my county alone, and there's nothing in the plan about agriculture. And so I think those are misses that we need to start talking about it more across all of the planning that's happening in the state.
Yeah, Gwen, I so appreciate that comment. So, because I also work here in Wayne County on the Pathways to Prosperity project, and we've been working on we did the Wayne Comprehensive Plan, and was like, well, agriculture is a part of our community, but there's no like indicators, there's no plan, there's no way, how do we think about that as like the factory floor, even for economic development and the things that are associated with that. Just also really quickly, like one other story about some of the meetings I've been sitting on with EMA, they did an exercise around nuclear, if there was a nuclear event, was it Perry, the nuclear power plant up in northeast. And the person that they brought in from emergency management was saying, like, well, if there's a disaster, then somebody's just going to go and tell the farmers there that what's a plant that's going to absorb the radiation. Right, exactly, Dan. Yeah. So right, you're like, first of all, like, also Department of Ag has not really been helpful in terms of actually letting farmers know even that they live in a blast zone, number one. So like, how are you going to find these folks? And then just like the ridiculous statement about where they're just suddenly going to transition into something else is just, yeah, there's so many issues with that statement. So I think that they, right, like there's like this huge disconnect in how we're thinking about all of these different things. And if we don't start to see also like agriculture as part of our resilience in the long term, right? Like we are so lucky here in Ohio for our prime agricultural soils, right? And if we're not protecting them, that's actually going to make us more vulnerable to any of these types of disasters. Like when we think about what's happening in Ukraine right now, like I'm always like, I'm really glad I live where I do, because I know that we'll have food.
Yeah, well, Shoshana, I tell you, I don't think we've met personally, but I love you.
Oh,
Because I'm going to tell you why. It's interesting, and I'd like to say this. I think we need to sit down and talk for a couple hours over a cup of coffee, or I will take you to lunch when I get to Worcester, because I'm going to say this. Welcome to my world. Besides what I do now, you've seen here, I get called in on those things. And there's been a couple of incidents during the Voinovich administration when there were propane shortages in sub-zero weather and trying to get at the animal husbandry operations. I literally got drafted and called in basically by EMA, and they're going, how do we do this? And here's the simple approach, guys, and this is how we're going to do it. And it was like for 2 weeks, that's all the same hell I was doing for them. And you know, my blood pressure is going down and my heart rate's going back to normal because you've basically helped me relive what I was personally going through in the early parts of COVID, because I belong to what's called OP3, Ohio Public-Private Partnership with EMA, and was called in with that and got called in with regard to FEMA. It got to be the point, you're correct. Guys, this incident is not local. It's going to last months. It's national in scope. What in the name of God do we do? It wasn't for a couple of leaders at the federal level that said the conference, damn it, I don't care about what rules and regulations are going right now. This is what we are going to do. And what do you suggest in different things? And it was everything from getting passes for people to drive past checkpoints so they could go to their job either at the supermarket or the food processing station, having permit waivers and things for truckers and different things. As you said, I was involved with regard to that. If people only understood what was going on at Rickenbacker during this whole time, with flights of stuff coming in from all over the world on trying to address this issue, it's absolutely huge. It got to be the point. When I saw that slide in the meeting, and they said, this is Bedlam. And I'm going, yeah, you're right. Fog of war. And guys, and I tell you, we had some guys basically literally said, throw this aside. I don't give a damn what the rules and regulations are right now. We've got a problem here, and we're going to have to work through it. And we're going to have to create a solution and something serendipity to get it done. That was what was happened. And like you're saying, no discussion. You're the first one I've been able to see who is talking about that right now. What's the after effect? What's the plan going forward? What do we need to do? State government, federal government's not looking at it. It is going to happen again. I was in the room when that guy said something about Perry and about this is what the farmers need to plant basically in radioactive soils. And I went, you are an idiot. But no, that's the kind of, and I tell you what was really bad about this, the ones who took the lead and said, all right, how do we make this work? We've got to get stuff from point A to point B. We've got to get food processed. We've got to get it transported. We've got to get medical supplies here and there. How do we do it? And the discussions and the strategies and things that we did, sitting down with local EMA going, do you understand that this milk truck needs to go across this bridge to get that milk, to get it here? Oh, I never thought about that. That kind of stuff was going on. It's also interesting on the federal level, those guys who took the initiative and took the command sequence and said, let's do this, no longer are there because they were fired because they didn't practice and go through policy. But we had a lot of people basically who didn't starve, didn't die, didn't have health problems, who were still operational as farms, food processing and things. Like you say, we learned a lot, but it's going to repeat itself because we haven't applied those lessons now. I'm so glad that you're doing this.
Oh, Yeah, thank you so much for sharing, and thank you for all your work for helping us get through COVID. I'm just really curious, like when you said that the federal level was bypassing, what part of the federal government was working on that?
Well, it's interesting. I was involved with FEMA and I got drafted in working with folks, and it basically had to do with logistics, getting stuff from point A to point B, getting food processing done from these processing centers, getting it to supermarkets, what was happening on local levels. We had local level people calling in saying, I have this problem. What do you suggest I do? It got to be the point because, and these were not, say, the heads of FEMA, but have I seen some of these guys on national news before, during, and after that? The answer is yes. They were far enough in management. They said, you know, I've been here for 30 years. This is what I'm seeing with regard to this. The hell with what they're saying. What do we do to make this work? Because we're going to have people die if we don't. And they took the initiative basically to do it. They no longer work for government because they didn't follow policy, but a lot of people survived. That's what I don't like about this whole process. And like you say, you helping us share and preserve those experiences are going to be absolutely huge.
Oh, Dale, thank you. And I think that was our hope with the report, that if we could leave a cookie crumb trail that others could pick up from, and use that for how they see best in their communities, whether that's at the local, state, or national level.
Yeah.
But I would love to have a cup of coffee with you.
Yeah, because that's absolutely huge. It got to that particular point. They said, the hell with this. I wouldn't say it was a mutiny, but they're saying we're going to have people die. These guys, they're gone. We're doing this right now, and we're going to follow this particular sequence until we get this thing remedied. It got to be that particular point.
Yeah. Yeah.
But no, it was.
Yeah. And I think to Gwen's point, like we don't always appreciate the role that food and agriculture plays in our economies, right? In our economic development and our stability and the ability of workers to get to work even, right? And like for society.
We have
and
a lot of food
communities to
processing
function.
places that literally we're under quarantine here. Your employees can't get to here because the state patrolman or the county sheriff or their city policeman basically is taken to a checkpoint and said, you don't have a pass, get home. Or you've got truckers basically, because they're at their 12-hour limit on their permits for driving and different things, lifting that up, getting them basically in some places where they can get fuel to keep going. You know, it was strategy wins battles, logistics wins wars. The logistical issues here was absolutely huge, and being very practical, making decisions on the fly, understanding the repercussions, telling basically someone higher up that, well, this doesn't follow policy and I really don't give a damn basically what you're trying to take a look at in front of the media. We need to do this. It's absolutely huge. You basically helped me relive what I went through, my own little personal hell in March of 2020. It's like, no, it just, yeah, that whole time was just crazy.